Right, let's talk about picking your ACL surgeon, because yes, it really does matter. Even if you are watching this and you're under the NHS, National Health Service in the UK, you absolutely can have a say. And honestly, your surgeon can be the difference between getting back to sport or feeling like your knee is just never the same again. And if you are under the NHS, remember, you are absolutely entitled to ask for a second opinion. You might have to push for it a little bit, but it's your knee, and ultimately you need to have the right person for you looking after it. Now, I have a little bit of personal experience here because I had 2 knee surgeries when I was much younger, and both times the surgeons was basically telling me, don't bother trying to play sport again, squash, not going to happen, your knee, unfortunately, it's just never going to be the same. To be honest, that alone should have been my warning signs that they don't know what to do, they don't know how to help me, because both of them, unfortunately, I stupidly let them go into my knee and they just took things away. They didn't try to even repair anything. And when I look back or looked at those surgeons, both of them are experts in joint replacement. So they spend their whole day removing joints. And this is why I've made this video, because you do not want a surgeon who spends their full week just removing stuff from old knees. You want someone who's an expert in joint preservation. I cannot reiterate that enough. Someone who's doing ACLs all day long and multi-ligaments as well, not just replacements. So the first thing I want you to actually look at is, what do they do all day long? Who actually are they? Who are they operating on? What is their majority of their surgical list week by week? Are they seeing young athletes and multi-ligament injuries, or are they just looking at mostly older patients who need replacements and paracetamol? Makes a big difference, and that should be a massive priority to you. Whose list are you on? Second thing, how many ACLs are they doing each week? You want them doing these surgeries weekly, not just 1 or 2 a month. Next, and this is a big one, what grafts can they offer you and why? Because here's the thing, some surgeons will just do the graft that they're most comfortable with, or the one that they like to do, they prefer to do. And ultimately, that might not be the best graft for you. And remember, it's your knee, it's your life. Every graft is basically robbing Peter to pay Paul. And it's quite ironic that the surgeon in the thumbnail is called Paul Tricker, Mr. Tricker. Anyway, your graft is your choice, and it matters hugely for your sport and your lifestyle. Like, as an example, I wouldn't suggest for a firefighter to have a patella tendon graft, because they're climbing ladders all day, they're often kneeling, they're often crouching, they're in awkward spaces, and a patella graft for them would likely lead into anterior knee pain and just ongoing issues. Another prime example would be sprinters. I would tell them to stay away from hamstring grafts. Somebody that's had patella tendinopathies in the past, I would tell them to stay away from a patella tendon graft. And this is where the surgeon really matters, because your surgeon should be taking a proper history of your past injuries and knee pain. And that's essentially why or how they can offer you the best graft for you, not just the graft that they prefer to do. Also, what you need to ask them is, how long have they been doing X graft for? Because sometimes there's like a new harvesting technique and suddenly everyone jumps on that type of graft. Like recently, quad tendons, they went out of favour for a while because of the re-tears and persistent pain that people were experiencing. Now, all of a sudden, some surgeons are back doing them because the medical sales rep teams have come out with a different way of harvesting the graft. You don't want to be someone's guinea pig. Also, another thing that's rarely discussed is something called an LET surgery. So that stands for lateral extra-articular tenodesis. If your surgeon starts talking about doing an LET alongside your ACL, you need to know why. What's the criteria that they're basing it off? Because it should be backed by studies, not just because they think it's a good idea. It's usually suggested for people who are hypermobile or who have had failed ACL grafts before in the past, or athletes doing certain extreme sports like skiing, wakeboarding, those types of things, but also for people that have had big meniscal tears and people below the age of 25. A good surgeon will explain why they think that you're a good candidate for that, because it's an extra procedure, extra incision, and sometimes slightly more recovery, only if you go about the recovery the wrong way. So don't be afraid to ask, do I need an LET? You know, is that something we can discuss? Do I really need it, or is it not a good idea for me? Would it be a good idea for somebody who's had a lot of IT band issues? But your surgeon will discuss that with you, or ultimately a good surgeon will discuss that with you. Another thing that no one really talks about much, but I have a little mental list in my head, is how long does your surgeon take to do the surgery? Now, hear me out. It's not about rushing, okay, but it's the fact that your leg has a tourniquet on it, and some surgeons, or some of my patients, the theatre time for the tourniquet on was like 3 hours. So if it's taking 3 hours for a surgeon to do an ACL, I genuinely think you shouldn't be doing it, because it's way too long for your leg to basically be dead. A highly skilled surgeon should be in and out for a straight ACL within about 45 to 60 minutes. So if your surgeon is talking about 2 to 3 hours for a standard ACL, I would say personally, they're not doing enough of them, and try to find someone else. Another big clue about what they're going to be like is how they treat you before surgery. This doesn't necessarily look at their surgical skills, but it's certainly something that you want to think about, as how approachable is your surgeon? Will he listen to you? If you have a problem, is he going to know how to rectify it? And also just take a moment to understand where you're at, whether physically or mentally, so that he can weigh up, or she can weigh up, you're struggling and they perhaps need to help you. Because what they're like before surgery is a big indicator of what they'll be like after surgery. They don't need to spend an hour in clinic with you, but when they are with you, they should really listen, examine your knee properly, and make a crystal clear plan. Take Mr. Tricker, for example. He's the surgeon I send literally all of my knees to, because he listens. He's very skilled, but he listens, and my patients really like them, and the outcomes are amazing. His consults are nowhere near 60 to 30 minutes, but every single patient says the same thing. He really listened to me, examined my knee properly, and we made a plan in that appointment. Sometimes that appointment might only take 10 to 15 minutes, but you leave knowing literally that you've been listened to, and there's a clear plan in place for you and your knee. And honestly, if a surgeon's got loads of time on their hands to be chatting and chilling and kicking back, I'd be asking why, because why isn't he busy, you know? Another thing I look for is, does the surgeon actually speak to your physio or clinicians in general after the surgery? Because the best surgeons, their PAs, they have the notes straight with you. They let me know if they've seen anything untoward or anything that may change our rehab to what I've kind of predicted or set out. And ultimately, it's a team job. And you want a surgeon, ideally, if them and your physio is on the same page. Another example, Mr. Tricker communicates with me so openly and easily with our shared patients, and it really does make my life so much easier. Another good sign, and this one's absolutely key for me for a good surgeon, is that they look at your scans themselves. Good surgeons don't just read the radiologist report. They look at the images and they look at your knee, because sometimes what's written in that report doesn't tell the full story. Your symptoms might not marry up with that report. And they can pick up things like meniscus tears, cartilage damage, and plan ahead for the surgery that your knee might need. Because they might say straight ACL tear, but they might look at the scan and go, they've got locking, they've got clicking, and actually I think I can see a bit of a meniscal tear. So you can be ready for that. So a surgeon in the appointment will review the MRI images and your knee. A thorough examination is key, and also listening to your background and how your knee's been feeling ultimately. Also, if your case is a bit more complex, or you've had a failed ACL before, you definitely need to be asking your surgeon how many ACL revisions do they do, because that's a different skill set altogether. Revision surgeries sometimes have to fix multiple grafts or previous surgeries, and the real experts can often do it in one go, one surgery, while less experienced surgeons might make a total meal of it and have you doing like 2 or 3 stage operations, when often it's not actually needed. Another one, if you're under the NHS care, just want to know, it's worth politely asking, will that surgeon you're speaking to be your actual surgeon, or will it be a registrar? There's nothing wrong with trainees learning, but it's nice to know who exactly is going to be doing the surgery, whether it's the registrar or it's actually the surgeon. Another thing we look at more as therapists is the incisions, because I know brilliant surgeons who do great ACLs, but they leave massive scars, okay? And in that instance, I would probably say to my patient, look, you are a model. I probably wouldn't use that surgeon because you use your legs for a living. X, Y, Z type of conversations that we can often have. are slightly out of that boundary of rehabilitation, because we talk about all things in terms of helping our patient and their recovery. Again, the surgeon who I refer to, Mr. Tricker, his scars are tiny. I'll probably put like a little overlay of one of my knee, but they're that small, they would make you doubt that you've actually had surgery. You can't judge a good surgeon on purely scar size, but as therapists, we do quietly know like who the butchers are. A really good surgeon, NHS or private, will tell you rehab is key. You need to work with a specialist. The surgery is pointless if you don't do good rehab. It needs to be specific, and you won't get back to sport without it, or by being cleared by an actual ACL specialist. And that is what you want to hear. Because remember, the surgery is just step one. It's actually the rehab that you'll do with somebody like myself, or perhaps follow my complete ACL recovery guide, that gets you back on the pitch or into running or whatever it is that you want to do. Now let's talk about private versus NHS. Private ACL surgery these days is about £10,000. I paid £8,000 in 2021 for my ACL. And do you know what actually blew my mind was the fact that the private hospitals around me, where the experts are nowhere near as good, not quite sure who will watch this video, maybe I might edit that out, I'm not sure. I'm a woman of my word though, I'm only speaking the truth. But basically, the cost around your local hospital will probably be the same as going to a big name expert in London. So always weigh that option up. Don't just settle for your local health and look into actually having an expert in London, because it really does make a difference, trust me. So with private, obviously, you can pick the surgeon, you can pick the hospital, and you can pick the date. NHS, you can still pick your surgeon, but you might have a long wait time for both the surgery and to see the new surgeon, because often when you want a second opinion, you rejoin the new surgeon's list and it's almost like starting all over again, but you definitely can't pick your surgery date. It's usually a call or a letter a few days before. Personally for me, I felt so different after my private surgeries compared to the NHS ones, just like having the ice machine on my knee straight away, physio coming to you immediately, having a chat, having time to sit with you, saying, are you ready? Let's get you up, let's have a bite to eat. All of those little reinforcements, like also as well, they give you lactulose, they give you a full list of medications that you're going to be taking with a full bag of all of those medications, all very clearly listed out. They will phone you 24 to 48 hours after the surgery. They also give you a limbo leg cover so that you have a waterproof cover for your legs so that you can shower to your heart's content, and they literally pack it in your bag for you. The only reason I found mine is that when we got back, it was in my backpack, so somebody put it in there and I don't know who. One time as well, I explained to my anaesthetist that I have a heart condition and sometimes my potassium can drop ever so slightly low, and it just triggers my arrhythmia, it makes it far worse. So while I was asleep, he ran a blood test and checked my potassium, and it was a tiny bit low and topped it up. And when he woke me up, he was like, yeah, a little bit low, topped it up. It's just like the added extra, you know. Another time I said that I'd had terrible nausea after my last surgery, and he actually gave me some medicines before I was even put to sleep and after. Just those key things of them listening and taking on board what you've said and making the relevant changes before something happens that's probably not going to be too pleasant. Private just feels more like they're ready to get you moving and working hard right away. Whereas NHS, sometimes your physio appointments go missing. Nobody tells you when to change your plasters and you have to go back to your GP for paperwork, referrals. Private hospitals send you home with spare dressings, tells you when to change them, gives you everything you need. You're not relying on your GP, because ultimately, you shouldn't have to have ACL surgery and then be going to your GP to get your bandages changed or see a nurse to have the plasters on your knee changed. You have to take ownership, just like you do with your rehab. You know, actually do these things. And I think the private hospitals do such a good job of patient education, telling patients exactly what to do. And if, you know, you might forget it, they ring you the 24, 48 hours after just to remind you of everything because you've had anaesthetic. It really does make a big difference. So yes, choosing your ACL surgeon really does matter. Sometimes people are just completely unaware of what the surgery even involves because the surgeon hasn't explained it properly. And in some cases, I actually think that some people shouldn't even have surgery. I really do. But that's probably a video for another day. But you have the right to pick your surgeon and make sure you pick somebody who's going to pick the right graft, talk to you about rehab and do everything that's right for you and your knee. And just to be clear, even with the best ACL surgeon, ACL rehab takes time. You're not going to be back at sport until at 3 months, you know, you're talking 12 months. The surgery sets you up, but it's the rehab that actually keeps your knee safe. If you want a step-by-step guide for something like that to see exactly what to do and when to do it, you can check out my complete ACL recovery guide, or just make sure that you find an expert that can set your expectations prior to getting surgery and then work with you appropriately after the surgery. If you've enjoyed this video, please give it a like, maybe even a subscribe, and I'll catch you in the next one.